compared to before the holidays. Since the holidays, the numbers have grown exponentially. And let me explain to you what that means. One measure of the disease spread is the effective reproduction number, or otherwise known as the R effective. The effective reproduction number is the number of people who can be infected by one individual case at a given time in a population. The higher the value of R effective, the faster more people become infected. If the R effective is greater than 1, COVID-19 will spread exponentially. If R effective is less than 1, COVID-19 will spread more slowly and cases will decline. Santa Barbara County's effective reproduction number is highest in the state as of today at 1.27, and this is an estimation by CDPH. In other words, the rate of COVID-19 spreading is higher in Santa Barbara County than any other jurisdiction in California. These are really grim numbers. Extremely concerning. The effective reproduction number is affected by a number of factors, including the number of susceptible people, the number of new cases, and people's behavior, like social distancing and wearing a mask. Unfortunately, our COVID metrics continue to be extremely high. On Sunday, we had our highest number of cases reported in a single day with 779 cases. This substantially beats the previous record by over 200 daily cases. Compared to before the holidays, this is an increase of over 600 daily cases. The number of active cases today is 2,786, and this is approximately a tripling of active cases since before the holidays. COVID-19 hospitalizations and ICUs have increased by 4-fold since the holidays. Our case rate is nearly 90 per 100,000. This is a doubling since the holidays. Testing positivity is about 16%. This is also a doubling since the holidays. Weekly deaths have increased 4-fold since the holidays. So this is really a dire strait in our county. And I'd like you to join me in a call to action. Next. Please vaccinate when it is your turn, when you are eligible. Please take the opportunity and accept the vaccine. And remember the 4 W's. Wear a mask, watch your distance. Please stay at least 6 feet apart. Wash your hands, and please wait on gathering. It really is not the time to gather outside your household. Please stay at home and leave only for essential needs. You know, I'd like to end with this. Our community residents and businesses have endured so much during these past 10 months, and I know that everyone is anxiously waiting, anticipating the time when our community can finally return to normal and we can reopen our schools, our faith community, businesses, to name a few. We are hopeful that the vaccine will soon provide the path to normalcy, just as I shared. However, COVID-19 is still raging throughout our community, so please join me to make a difference to end the spread of infection in our county. Thank you. And now I'd like to introduce to you Dr. Ansor, our County Health Officer.
Thank you, Director Reynoso. Good afternoon, everyone. Unfortunately, our case rates, as we just heard, are not coming down. Quite the opposite. We are now seeing the consequences of extensive gathering, traveling, and mixing and mingling over the holidays. Our hospitals are caring for an ever increasing number of people that are sick enough to require hospital care. We anticipate this trend will likely last into the month of February. I would like to take this opportunity again to explain why social distancing and mask wearing are so important. The coronavirus is spread most easily by people who do not look or feel sick. Most virus carriers are unknowingly spreading the virus just by talking, laughing, singing, or even just by breathing. Indoors, this virus can linger in the air for several minutes up to a few hours, and this depends on the size of the room and the ventilation. The more people get together, obviously, the higher the risk for virus to spread. We have an extremely high testing positivity rate now in Santa Barbara. It's approaching 20%. This means we can anticipate that almost 1 in 50 people are currently actively spreading the virus at any given time. That is why the safest precautions for everybody are still sticking to our household bubble and wearing a mask. Outdoor activities where social distancing can be maintained are much safer than any indoor activity. Even shorter distance trips are really not advised, given that the whole region has so much virus activity. The majority of our hospitalized COVID patients now are people in their 40s and 50s. Even young and otherwise healthy people can get severely ill from this virus. The number of vaccine doses we are able to receive from the state is unfortunately much less than initially anticipated. We are hopeful, however, that the vaccine production and the delivery will increase drastically over the next few weeks. So far, about 15,000 doses have been administered in Santa Barbara County. I am pleased to announce that there have not been any major vaccination reactions, and the vaccine seems to be tolerated quite well. Also, I want to address that there's some misinformation circulating on social media that the COVID vaccine could cause infertility. I would like to clarify that this is not backed by any scientific evidence. In fact, several women of childbearing age who were enrolled in vaccine trials did conceive after having received the vaccine. We, as the Public Health Department, are collaborating closely with our hospitals, our pharmacies, outpatient clinics, and other providers to get as much vaccine administered to people as soon as possible. We are preparing tirelessly to be ready to vaccinate on a mass scale as soon as sufficient vaccine becomes available. In the meantime, please choose safe options for your socializing, entertainment, and exercise or work. Wear your mask, stay at least 6 feet apart, avoid crowds, and get vaccinated when it becomes available to you. Thank you. I will now introduce to you Sue Anderson, President and CEO of Marion Hospital in Santa Maria.
Hi, thank you, Dr. Ansor. As he said, I'm Sue Anderson. I'm President and CEO of Marion Regional Medical Center. You know, just like everyone said already, Marion Regional Medical Center is experiencing a COVID-19 surge greater than what we have seen to date. Over the past few weeks, we've seen an increase in our ICU patient volume. We've enacted surge plans and are utilizing additional bed space that we prepared just for these types of situations. We were very fortunate. We have, as many of you know, we have a new hospital building that was built in 2012, but we also have our original hospital building, and we've converted many of those rooms back to patient rooms, so we were able to get an additional 48 patient beds. Our supplies are good. We have, there have been reported oxygen shortages throughout the country, but we're doing well with oxygen right now. We're doing well with our personal protective equipment. Our staffing, our ICU numbers have doubled over the past few weeks, and our ER capacity has increased, but we've remained prepared with beds. However, it's staffing that continues to be a problem for all hospitals across the country. With our prevalence, our community prevalence of COVID-19 increasing, our staffing levels have been affected. Our employees and physicians are incredibly dedicated and have been working tirelessly since the inception of the COVID-19 pandemic. However, with this demand that has been put on them, both physically, mentally, and emotionally, they're growing increasingly fatigued as they continue to care for our community. As we've talked about, we're starting to vaccinate more. We've been fortunate, we've vaccinated our entire healthcare staff, everyone who wanted to get vaccinated, which was the majority of them, and most of them have had both vaccines now. We've tolerated it well. Everybody, in fact, was excited and happy to get the vaccines, and it brought hope to our employees and physicians at a time when they needed it most. We're working closely with the county and the other hospitals in the county to help in the effort to vaccinate our community. We started vaccinating certain hospital inpatients upon discharge and are planning to start the effort to vaccinate those over 75 within the next week. Overall, despite the current surge, Marion Regional Medical Center continues to have sufficient beds to care for both COVID-19 patients and the community. Don't put off your care. And I want to personally thank the county and the other hospital leaders who throughout the last 10 months have worked closely together to make sure our community receives the care that they need. I also want to thank our team here at Marion Regional Medical Center. I've been so proud of the team here and actually at all of our county hospitals for putting patient care ahead of their own concerns, for showing compassion and care to our patients even when they are exhausted, and for showing true human kindness. Please take time to thank the medical community in our county and show them that they are appreciated. With COVID-19 cases on the rise in our community, we continue to encourage community members to do their part to slow the spread. And as you've heard already on this conference, avoid social gatherings, spend time with those in your immediate household, masking, social distancing, and hand washing. Our caregivers are pleading with the community to help us stop COVID in our community, in our county. So at this point, I'd like to introduce you to Suzanne Grimmie and from Santa Barbara County.
Thank you very much. My name is Suzanne Grimmie. I serve in two roles in relation to my work with Santa Barbara County and COVID-19. I provide support with community behavioral health response to the pandemic, and I work on the communications team for COVID-19. I have the opportunity to speak daily with numerous community members through the community wellness team phone line, as well as be connected to those in our community reaching out to the call center. We hear the frustration in your voice. On the communications front, we've created a link where the public can sign up to receive updates on vaccine information. We heard the governor's announcement in prioritizing those over the age of 65 for the vaccine, and we're excited. We've pivoted and we've worked as hard and fast as possible to make sure we can reach the population over 65 and over 75 with vaccine invitations. As you have heard shared, we are doing this in two steps, as Dr. De Reynoso shared. Those ages 75 and older can register to receive vaccine appointments now by signing up online, by calling 211, or through notification from their healthcare providers. The next group, those between the ages of 65 and 74, will receive invitations to get vaccinated as soon as supplies are available and can sign up in the same ways. On the behavioral health front, for the past year, We have faced so much uncertainty, disruption to our daily routines, and now the stress of waiting for our turn to get the vaccine and trying to understand when our turn will come up, how we'll get notified, how to schedule an appointment for the vaccine, and more. People who call sounding frustrated are worried and really stressed. And this is normal. We're all feeling this way. It's important to recognize what the human stress response looks like. People are trying to find information on multiple sources and getting frustrated with what might seem like a lack of clarity or the time that it's taking for their turn to get the long-awaited vaccine. The human stress response can take place in a fight or flight mode for self-protection. People want the vaccine, we know that. They want to know that they are safe and protected. We all want that. Feeling and sounding upset or frustrated when calling to get information makes complete sense and couldn't be more normal. Public health is working as fast as possible to make the system to sign up for vaccines as easy as possible, while managing the demand with the current supply of vaccines as more are awaited. A reminder for all of us, continue to focus on your self-care. Be extra patient with others and with yourself. We are at an exciting chapter right now, beginning to vaccinate our local community with the end, all being vaccinated, starting to show on the horizon. We're almost there, and together we can make it to the finish line. This is an amazing, resilient community that we live in. Please show kindness to others. We're all feeling the stress, and stay safe. Thank you.
Thank you, Suzanne, and all of our speakers. We're now going to open it up to questions from our news media, and there are many standing in line waiting with their hands raised. So first up, we are going to Tom Bolton with NewsHawk.
Good afternoon. I have a couple questions today. My first one is for Dr. Del Reynoso. I've shared with you some examples of smaller assisted living kind of facilities and group homes that have yet to do any vaccination. And I'm hoping you can explain what public health is doing to make sure that that high risk, high priority group is getting dealt with before you start doing other folks.
Thanks, Tom. That's a really good question. What we are doing threefold. What we are doing is we are continuing to ramp up our public community vaccination sites. We are furthering recruiting our healthcare providers. We currently are allocating vaccines to 19 provider sites so that they can also partner with us in providing the vaccines. Thirdly, we are exploring partnerships with community groups to create mobile units where we can go to sites like you mentioned and other specialty vulnerable communities so that they can get vaccines as well. So those are our three strategies.
So do you reach out to those entities? I presume you have a list of all of them.
Yes, we do.
Because some of what the folks that have contacted me have said they keep reaching out and basically nothing's happened. I guess some of them were supposed to be getting vaccinated through the pharmacies, CVS and Walgreens, but that hasn't happened. So there's a lot of frustration going on with some of and it seems to be the smaller ones.
Right. I can definitely sympathize and understand the frustration. And that is why we have partnered up with our hospitals to be able to support the SNFs that they work with, as well as we anticipate when we finally launch the mobile units, we're able to support the smaller living facilities. And on top of that, we are adding more retail pharmacies. I understand that some of the skilled nursing facilities, some of the other facilities have partnerships with CVS and Walgreens, and they are frustrated at the length of time that those pharmacies are serving them. And so that's why we're also offering them opportunities to be vaccinated as well.
All right, thank you. My other question is for Ms. Anderson. We get a daily update from Cottage Hospital regarding their status, and we've requested similar information from Marion. It's not been forthcoming, and I guess I'm wondering what the prospects of are getting some kind of a regular update of that kind of detail, because it's extremely helpful in understanding what's happening.
Yes, I mean, we report all of our data on the, every day we give a report to the to CHDP, and our assumption was that everybody could get the same data from the same resources, with, the data that we present every day as it is. So I can talk to you, we can talk to you offline, but that was what our hope was that you could just get the data you needed from that.
Yeah, it unfortunately doesn't really work very well that way. So yeah, I'm happy to discuss it with you, but it would really be helpful. And I can send you, in fact, I had previously sent an example of what Cottage does, which has been fantastic, really. And they've done it from really the get-go. So thank you for considering that.
Okay, yeah, we'd be happy to give out information.
Thank you.
Thank you, Tom. Next up, we're going to Malia Martin with the Santa Maria Sun.
Hi there, good afternoon. I have actually a couple questions about influenza prevalence in the community this year as it might relate to COVID. I have heard various reports that statewide we're seeing record low numbers of flu infection, and I was wondering if that's the case in Santa Barbara County, and if so, if you think the cause might be somewhat related to more people indoors due to COVID or something else. Any information there would be appreciated.
I'd like to point you out to, we are tracking, and the data, influenza data is available on our community data site. And I just happened to look at the data right before the press conference, and you're absolutely right. I see a much lower trends across the prevalence and hospitalization as compared to other years. And probably what I'm hearing is that it's due to the social distancing. It's due to people wearing their masks. So those are netting good results with regards to the spread of flu. Dr. Ansor, do you have additional thoughts on that?
Yes, the influenza virus is in many ways similar to the coronaviruses because it's a respiratory virus that is spread through our expirations with tiny droplets. So if the more people protect themselves with wearing masks, washing their hands more often, and keeping at least 6 feet distance from each other, it will protect from other viruses. We are also seeing that other normal cold viruses are much less prevalent so far this winter. And it's very likely, the only explanation we have so far is that it's really the protection that a lot of people are maintaining.
Thank you. And then one follow-up question to that. I have seen some, I guess you might call them conspiracy theories, that the reason for lower flu rates this year would have to do with COVID potentially being counted as the flu. So what would you have to say to such a claim such as this?
Well, those are completely unfounded claims. That is misinformation, unfortunately, that's spread on social media widely. As you mentioned, there are some conspiracies. Also, as I mentioned, that the COVID vaccine would cause infertility is completely unfounded. Things like that spread easily. There's really no, we are testing, the urgent care centers and the emergency rooms are testing for a whole set of viruses when somebody comes in with these symptoms, and the test results don't lie. There are some positive for influenza, but it's much less than in usual years.
Thank you very much. I appreciate it.
Thank you, Malia. Next, we're going to Laura Place with Santa Maria Times.
Everyone, I have a couple questions as well. My first one, So it sounds like yesterday, or I guess Wednesday, Lompoc Valley Medical Center opted to begin vaccinating those 75 and older, so a little before the rest of the county. And because they had finished distributing their own vaccines to all of their eligible healthcare workers in their network. So I'm curious how different entities like the county as a whole and then individual providers can decide to move ahead, and why, if Lompoc had extra doses, why those weren't spread to the rest of the county to help the rest of 1A be vaccinated.
I can start that response. When we work with our providers, we give them, we authorize their ability to move past the current phase that everyone is in, simply because we don't want spoilage of the existing vaccines. It is difficult to transfer vaccines among providers. You can only do it once. So Lompoc did reach out to us with their intention to do so. Given that Lompoc is one of our health equity metrics area, and they have the availability of vaccine, and that they diligently had vaccinated the phase 1A appropriate in their network, we felt that it would benefit the community if they were to be able to reach out to the 75 and not let the vaccines languish. Dr. Ansor, do you have any additional comments?
Yes, I would just add that with the rollout of this vaccine, you have to allow for certain local nuances. It's not one size fits all. The population is different in different areas. The vaccine uptake varies and is completely unpredictable. If we know we have 10,000 healthcare workers in South County and 10,000 in North County, we do not know until we ask them to make appointments who wants the vaccine right now or who wants to wait a little to see how their friends are doing with it. So there are a lot of unknowns in this rollout of the vaccine, and time is of the essence, as Dr. Doran also said. Once, especially the Pfizer vaccine, once it's out, the shelf life is very short. It has to be used on that same day. So we have to give providers some wiggle room to make sure nothing gets wasted, because that would be really a shame.
Okay, thank you so much. And then looking at the allocation that the county has it's listed on the community data dashboard, it looks like the amount of ordered vaccines now matches, it is to say that the county has now ordered all of their allocated vaccines since earlier in the week. So can I ask why the county decided to order them all now versus earlier? Is it because providers are now ready to supply their own allocations?
That is correct. So, when we were able to reach down to the 75 plus, we have additional providers that can now vaccinate their patient population. And we have more providers with the capacity to partner with us. So we were able to draw down our full allocation.
Yeah, and I might also add that our public health clinic sites, we call them POD or pods, also have been ramping up significantly. So we just need more vaccine, and we just want to be proactive in getting as much vaccine into people as quickly as possible. And therefore, we don't want them to sit somewhere where they're not utilized. So that's our intention as well.
Question. So with the 1,200 doses that will be available through the pods next week to those 75 and older, Do you know what the allocations for that age group are at other providers? Like next week as a county total, how many doses will be available to that age group?
I don't have that information right off the top of my head, but that's something that we can communicate to you.
And that's all my questions. Thank you so much.
Thank you, Laura. Next up, we are going to Nick Welsh with Santa Barbara Independent.
Hey, thank you very much. I have a couple of questions here. The first one's kind of a follow-up. How many people in the county are 75 years and older? And how many doses do we have or will we be having to give them? And we read today in the Washington Post just a few hours ago that the second dose supply that the federal government thought it had been stockpiling, it turns out they weren't stockpiling the second dose. And there's some concern that the stockpiles are significantly more depleted than previously understood. And I'm wondering if you have any insights or illumination you could share on that point.
Yeah, go ahead, Dr. Dorino.
No, but again, I'm sorry, I didn't clarify. That would be either for Vaughn or Henning.
I can start with the age group. So for the 75 years of age and older, we are estimating that number to be 32,000.
Okay, and how many doses do you have?
I can tell you that we currently have all that's been allocated to us since the beginning of the vaccination period to now. It's 38,075. And so we have about a 51% already administered. So the remaining. We have also asked for an additional 10,000 from the state. So all these numbers really mean to say that we don't have enough for our county, and we will need to pursue additional vaccines so that our county, for everyone who is eligible and wants it, can get that opportunity.
Okay, so the 65 and older could be somewhere down the road. Based on those numbers. And do you have any concern that the supplies are much less than we thought and you're going to have trouble getting additional vaccines?
This is information that I am not aware of. What I can tell you is that CDPH has reassured us that we need to use all that we have been allocated so that we can draw down more, the state can, from the federal government. And then when they receive additional doses from the federal government, they will pass it to the counties.
Okay. One last question, and I'll shut up. This is for you, Dr. Ansor. I'm just like, if you could sort of explain a little bit more what that infection rate means, that we are the top in the state, and how did Santa Barbara County get that? That's a scary sounding number, but paint me a little bigger picture on that.
Yes, it really is a scary number. I would agree there. That is the case rate per 100,000 population that you're referring to, right?
Oh, I was thinking the infection, that weren't we number one in the effect of our...
Yes. Several factors are taken into account by the epidemiologist to come up with that number. It's quite complicated. And it has to do with how many test results are positive, how many new cases we have, and in particular, how quickly these cases increase. And we had these jumps from having somewhere 100 cases a day. All of a sudden, the highest peak was 700 a day, excuse me, which is very concerning. And I think that plays a big role. it shows an exponential growth of the virus, and the faster, it's a little bit about speed. How fast does this virus spread, and how many people does an average virus or viral carrier infect? And those put together, Santa Barbara is simply a very beautiful spot. As we all know, it attracts visitors. It attracts a lot of activities, and it's a very social town. People like to hang out together and to party. And I think that all plays a role.
Thank you very much.
Thank you, Nick. And next up, we're going to go back to Brooke Holland with News Hawk. Your hand was up earlier. Go ahead, Brooke.
Hi, thank you. There have been a high number of recent deaths reported among congregate care living outbreaks. I was wondering which ones and what kind of facilities those are, the outbreaks and the deaths.
We are only allowed to report if it's more than 11 cases in a particular facility. So that's our limitation due to privacy issues.
Okay, can you speak to what's being done then to contain the outbreaks among congregate care living?
Yeah, it's extremely challenging because, you know, elderly people who are frail and live in these environments, they have the highest fatality rate of all age groups by far. Anywhere between 25 to 30% of infected elderly folks in these settings actually die from it, and that is very high. So it's so challenging because for various reasons, and skilled nursing facilities or nursing homes or rehabilitation centers and so forth, they usually are plagued with not enough staffing. That plays a role, and they are challenged that way. We are really working hard with them and to keep the best prevention measures to keep the infections out of the facility in place. And we educate them, the state educates them. There are whole teams who go out there and assess the facilities and then give very clear instructions. But once a facility has a significant outbreak under the residents, it is really, really difficult to manage. It depends a little bit on the layout of the facility. If it's easy enough to separate certain areas or a wing with infected people from uninfected people to keep them as much apart as possible. We have a whole team of public health nurses, a deputy health officer, and outreach from the state working on these facilities on a daily basis. And it's heartbreaking sometimes. It's very difficult.
Okay, thank you so much for that information.
Thank you, Brooke. Next up, I'm going to try and bring in the audio for Scott Sheehan with KYT. If we can't get his audio working, you should be able to go ahead, Scott. All right, then I'm going to read some of his questions that he sent in writing. Some of them have been pretty much answered. So the first question is, Mayor Garcetti and Governor Newsom said if people don't get the vaccine when reopening happens, they won't be able to go to concerts, sporting events, or other public gatherings. Will that happen here too? Is that Dr. Ansor?
Honestly, that is a policy question. We have not discussed this at our public health level. So I would defer that to the Board of Supervisors or to our policy team.
Thank you. His next question is, will there be a reservation system here in Santa Barbara County for people to sign up and register to get a vaccine?
The answer is yes. And as Dr. Del Reynoso mentioned, there's a phone number, 211, and there's a link on our website where you can make a reservation to receive the vaccine.
Thank you. And just since Scott can't speak for some reason, I just want to let you know that one of the other questions was about doses. Scott, I feel like Dr. Del Reynoso answered that as far as when we're getting our next and our quantities of vaccines. So with that, I'm next going to go to our last questions are from Fabiola Navarrete with Two Tempo Digital.
Hello, good afternoon, everyone. Okay, this question is for Dr. Van der Reynoso. We've heard that some farm workers have received a call to get the vaccine. We want to know if this is true because they said that it would be around January 20th. And if this is true, we also want to know how the vaccine will be distributed among this sector.
Fabiola, thank you for your question. I am uncertain where the farm workers could have gotten the call. It could be because they are part of a healthcare system. I know that healthcare providers who have vaccines are reaching out to the 75 and above, or the 1A. So I'm uncertain where they may fall into that category. It is something that the Public Health Department has not initiated at this point in time. In addition to that, I was on a call earlier with some colleagues to talk about vaccinations to the farm workers. And I am aware that in some communities, there could be scams as well to take advantage of farm workers, and that these are not in actuality legitimate calls for vaccinations. So I would want community members to rely on the information that we are publishing on our website, which is publichealthsbc.org, or our 211 call center should they need assistance in getting the newsletters, or should they need assistance in registering.
Okay, thank you so much. Okay, about the vaccine, another question. This is about employees of restaurants, markets, and all the staff that works in essential businesses. Do you have any idea if they are going to be vaccinated, or when are they considered to be vaccinated?
They are also in the phase 1B category. And again, because of our limitations in the availability, we simply don't have enough vaccines at this point in time. So we will finish up phase 1A, the patient-facing healthcare workers, and then we will be focusing on the 75s, and then after that, the 65s and above. And then after that, we will look at the essential workers. The direction from the state has been age over function at this point in time.
Okay, thank you so much. Okay, this is for Dr. Ansor. Do you know if there is a case in Santa Barbara of a person that has been infected with COVID twice?
We suspect that this has happened, but it is very difficult to prove. You have to do complicated confirmation tests that we cannot run at our local labs. So it's, I cannot give you a definitive answer, but I do know from talking with clinicians in the emergency room and at the hospitals that they have suspected, but it is a very, very small number. So far, we have not had any confirmation with the specialty labs.
Okay, thank you so much.
Thank you, Fabiola. That ends our Q&A and our press conference for today.
Gina?
Yes?
Yes, I'm sorry. Before we end, I just again want to encourage everyone who is 75 plus to call to register either via the link on our website, or if you need assistance to call our 211. And this is again for 75 plus.
Thank you so much, Dr. Dolinoso. And just to remind everyone, there is a holiday on Monday, so we will not be having a board meeting, or the Board of Supervisors will not be in session on Tuesday, but we will have a press conference at 4:30 p.m. On Tuesday to replace that meeting where we normally give an update. So with that, everyone have a safe weekend, and please wear your mask, practice physical distancing, stay home, and avoid gatherings, and we're going to get through this together. Thank you everyone this evening for joining us, and we will see you back here on Tuesday at 4:30. Thanks so much and have a good night.
Thank you.